Hi, this is Dr. Zhu from Huntington Family Dental Care. I made this video for my patients, friends, and everybody who has a lot of questions about COVID-19 vaccine. I'm a dentist with broad background training and a lot of research experience. I like to dig into the original data to get the answer myself. This video will answer people's question, are the mRNA vaccines safe? It also will compare the different vaccine used or going to be used in US. At the end, I also will go over quickly to answer, do I need to get vaccine if I had COVID? If I got vaccine, do I still need to wear mask and social distance? There are hundreds of vaccines in the world being researched now. 4 types are running at the front. The first type is mRNA vaccine. It is used in US already. This is the one people have a lot of safety concerns. So I'm going to go over this one first. This is how mRNA vaccine works. mRNA, M means messenger. RNA is a piece of genomic material which code the structure of protein. So mRNA is a messenger RNA. It only tells our body what to make. It does not integrate into our body. This is the structure of COVID-19. The spike protein on outside is the key to get into our body. mRNA of this vaccine code the spike protein. The mRNA is put into the small lipid particle from the mRNA vaccine. When the vaccine is given into our body, the mRNA get into our cell will start to make a lot of spike protein. When our bodies see the spike protein, our body's immune system will have a practice, learn how to get rid of the spike protein. When the virus with spike protein come into our body can get rid of the COVID-19 virus quickly. This mRNA does not amplify in our body. It only stays in our body for a short time and it will disappear. mRNA vaccine is a new technology. People worry about the safety of that. It only takes a year since the beginning of pandemic for the vaccine to come out. Is this vaccine safe? Actually, mRNA technology has been researched since 1990s. mRNA vaccine is also used to treat cancer successfully. The mRNA vaccine research for spike protein started at 2003 when SARS started. SARS structure is very similar to COVID-19's virus structure. So the research has been going for 17 years until COVID-19 started. They carry over the research result put into the mRNA vaccine for COVID-19 immediately. This is the latest CDC safety update about COVID-19 vaccine. In the report, it has vSafe data. vSafe is a cell phone app. People who got vaccine can report through that. Any problem they have, they can report. By the time the report comes out, 21 million people had got at least one dose of mRNA vaccine. 1/10 of the people report the data. About 15,000 people reported pregnant. The most common side effects are pain at the injection site, fatigue, headache, muscle pain, chill, fever, and all those. It's very common, and the side effect after the second dose is more common and more severe than the first dose. I got Moderna vaccine. After my first dose, I had pain at the injection site. It lasted a couple of days. After my second dose, I got pain at the injection site again. I also had fever, 100.2 degrees for 1 day. I had chill, I feel very tired, but after 2 days, everything is gone. Other people in my office, some are more severe. 2 of them had a fever higher than what I had for 2 days. Others has less side effects than I have. Because I have looked into the original clinical trial data, I know this side effect is very common, especially after the second dose. Everybody in our office schedule the second dose on the day the next couple of days do not have to work. You have to be prepared for the side effect after the second dose. These common side effects are not severe. It doesn't cause any organ damage. It only lasts a couple of days, it will go away. When you have side effects, you know your body is building the immunity. Another thing shown in CDC report is VAERS report. VAERS is Vaccine Adverse Event Reporting System. It's not a self-reporting. Doctors and hospitals has to report any problem they see after people get the vaccine. This is more serious problem. In the report, they have severe allergic reaction, which is called anaphylaxis. People probably have heard someone allergic to peanut or severe allergic reaction to bee sting. They have to have EpiPen with them. If they got the allergic reaction, they just need to give themselves a shot of EpiPen and the problem will go away. In the VAERS report, this allergic reaction is very rare. It happens only in 0.0005% in Pfizer and 0.00028% in Moderna. This severe allergic reaction is very easy to treat. The doctors, or nurses, or pharmacists, whoever gave you the vaccine can treat you easily and the problem can be over quickly. It usually happens within the first 15 minutes after injection, so you are required to sit there, wait for 15 minutes. If you have allergic history, you have to wait there for 30 minutes. Is there any people died after getting the vaccine? They have reported 196 people among the 2 million people vaccinated in the time period after they got the vaccine. However, natural background deaths among 2 million people in this period is a lot higher than this reported number. CDC has done thorough investigation on all the people who died, and they find their natural deaths not related to the vaccine, except one case. He is a Florida doctor, died 16 days after getting the vaccine. He got a very rare blood disorder. His platelet dropped to 0. He died from brain bleeding. In VAERS report, among 31 million people vaccinated, 36 got similar blood disorder. He's the only one died from this disorder. This blood disorder happened in regular people normally. The rate of this blood disorder in vaccinated people is not higher than the rate of normal people. So it's hard to tell whether it's time coincidence, it naturally just happened on that doctor, or it's related to the vaccine. Hematologists suspect the vaccine caused a very rare autoimmune response against the platelet, but they are not 100% sure if this is the case. CDC is still doing investigation on it to see if this blood disorder is related to the vaccine or not. However, this is a very rare blood disorder. I will not avoid COVID-19 vaccine because of this 0.0001% chance of getting this rare blood disorder, and it's not confirmed caused by the vaccine anyway. COVID-19's risk is a lot higher than this. COVID-19 had killed almost 500,000 people in US already. It damaged all the organs in our body. Even after the virus is gone in our body, people can have lingering side effects. Some people worry about antibody-dependent enhancement. Antibody generated from vaccine normally help the body kill the virus. If the antibody bind on the virus, not help the body kill the virus, it bring the virus in our body, it will make the disease worse. This is called antibody-dependent enhancement. In the 37,000 people vaccinated in clinical trial, independent committee had monitored the risk by reviewing the data. No evidence of this risk. By February 20th, 61 million doses of mRNA have been given to US people, and 40 countries has used mRNA vaccine. No case has reported. Will the vaccine cause Bell's palsy? Bell's palsy is a partial paralysis of your face. During the clinical trial, 6 out of 37,000 vaccinated people in Pfizer and Moderna got Bell's palsy. Only 1 in control got that. So it was a concern during the FDA approval. They had a big discussion about the risk of that. However, Bell's palsy happened to regular people. The rate of Bell's palsy in the vaccinated group is just tiny little bit higher than regular America. So they still approved that. After the vaccine has been used worldwide, this concern disappeared. Israel has reported 13 out of 2 million vaccinated people got Bell's palsy, which is a lot lower than regular people. So the Bell's palsy in the vaccinated group is just time coincidence. It's not caused by the vaccine. Should pregnant women get the vaccine? No final clinical study on pregnant women with vaccine yet. They're still working on the clinical study. US is supportive of offering COVID-19 vaccine to pregnant women. UK is against that. The reason US is supportive of COVID-19 vaccination to pregnant women is if pregnant women get COVID-19, it increases the chance of severe COVID-19 dramatically. And so far, there's no report of COVID-19 vaccine causing problem yet. So they said, talk to your physician. If you have high chance to get COVID-19, you should vaccinate it. If you have no chance, you can hide from home. You can wait until all the clinical study result comes out, and the result of there are 15,000 people in the 2 million people reported got vaccine. So those people will give us a lot of information. UK against that does not mean the vaccine is not safe. UK just want to wait all the result comes out and then give recommendation to pregnant women. Another concern is fertility with COVID-19 vaccine. So far, no data showing if vaccine can cause infertility. People are still studying on long-term effect of the vaccine on reproduction. In the clinical trial, when they first start clinical trial, nobody get pregnant. During the clinical trial, 23 women in Pfizer got pregnant, 12 in the vaccinated group, 11 in the control group, and 13 for Moderna got pregnant, 6 in vaccinated group, and 7 in control group. No adverse effect was reported. So there are the same number of people who got pregnant in the vaccinated group and control group. COVID-19 vaccine does not seem to affect people getting pregnant. However, even though there's no long-term result of COVID-19 on fertility, COVID-19 has been reported showing in the cells in male and female reproduction system. It changed the hormones in both male and female. Fertility Center also has reported cases that after people get infected with COVID-19, their ability of reproduction drops. So getting vaccine seems safer than getting COVID-19. I have talked about the safety of mRNA vaccine. Now I'm just going to talk a little bit about other vaccine. The second type of vaccine is called viral vector vaccine. Instead of using the lipid to carry the mRNA gene, this vaccine uses a very weak virus to carry the gene of spike protein. This virus is very weak. It doesn't make people sick. It also does not amplify in our body. When this virus gets into our body, the gene will get into our cell, and our cell will start to make a lot of spike protein. The third type of vaccine is protein subunit vaccine. Instead of our body make the spike protein, the manufacturer made the spike protein already. They put the spike protein into the small lipid particle, form the protein subunit vaccine. And when this vaccine gets into our body, the spike protein will release out, trigger the immune response. This is the comparison of different vaccines used or going to be used in US. The first two, Pfizer, Moderna vaccine, they're both mRNA vaccine. They are currently used in US and approved in many other countries already. The third vaccine is Johnson & Johnson's vaccine. It has been submitted to FDA for emergency use authorization, and the result will come out in February 26. The fourth vaccine is AstraZeneca's vaccine. It's approved in other countries, but not in US yet. Both vaccines are viral vector vaccine. The fifth is Novavax vaccine. It's protein subunit vaccine. It's still in phase 2, phase 3 clinical trial in different locations, and it is expected to submit to FDA for approval in April. All this vaccine can reduce the severity of COVID-19 infection dramatically. It has 100% protection from hospitalization and death. All this vaccine also reduce symptomatic case in the original strain. They have different reduction rate. Pfizer, Moderna, and Novavax has about 95% reduction. Because Johnson & Johnson and AstraZeneca use the viral vector, it's not pure spike protein, not like Pfizer, Moderna, and the Novavax, pure spike protein. So the efficacy is a little bit less. Johnson & Johnson and AstraZeneca is a little lower, around 70% reduction for the symptomatic case. They also all reduce asymptomatic infection. Moderna and AstraZeneca has number. It reduced about 60% for the asymptomatic case. Other companies do not have the exact data yet. Because all of this vaccine use the spike protein as mechanism to trigger immune response. And the current mutation strains are on the spike protein, so their efficacy against the mutation all dropped. Because Pfizer and Moderna's clinical study started earlier, their data are from the original strain. They don't have clinical data on the mutation strain yet, but they have lab tests prove their vaccine still work on the mutated variants. Johnson & Johnson's efficacy in Latin America reduced to 66% and 57% in South Africa. AstraZeneca's efficacy reduced under 25% in South Africa. So right now, South Africa has temporarily stopped use of AstraZeneca in their country. Novavax has 85.6% efficacy against UK variant and 49.4% against South Africa. All of these companies are doing the research on the booster shot against the mutated variants now. They all have 100% protection from hospitalization and deaths. That's the important part. For the number of shots, except Johnson & Johnson, every other company need 2 doses. 1 dose has big advantage. You just get 1 shot, it's over. 1 shot still have very good protection. The side effects of all of the vaccine are very similar. They all have the injection site pain, fever, fatigue, headaches, muscle pain, especially after the 2nd dose. Johnson & Johnson only 1 dose. Their vaccine has less side effect. Compared to flu vaccine, the side effect is a lot more. However, flu vaccine is only 40 to 60% efficacy. All this vaccine has a lot higher efficacy. The side effect indicate your body's immune system are working. Coming back to the question, which vaccine is better? Right now, there's a shortage of vaccine. COVID-19 has killed so many people, made so many people sick and hospitalized. Each person got COVID increased a chance of getting more contagious and more deadly mutation. So we are racing against the spreading and the mutation of COVID-19. Even though each vaccine has its advantage and disadvantage, there's some difference. All this vaccine reduce the severity of COVID and reduce the chance of death and spreading of COVID. The sooner everyone get vaccinated, the faster we can control the spreading of COVID-19. The less chance we'll get the deadly mutation. As long as they approved by FDA, whatever available for you, take it. People also ask me, do I need to get vaccine if I got COVID-19 already? Immunity after recovering from COVID-19 lasts 3 to 8 months. People can get reinfected with COVID-19 again. If you have COVID-19, test your antibody. If your antibody is still high, you can wait. If your antibody is already low, get the vaccine. You probably only get 1 shot. This shot is like a booster shot for people who do not have COVID. To answer the question, if I got vaccine, do I still need to wear a mask and social distance? Yes. All of the vaccine cannot stop the spreading 100%. They reduce the symptom dramatically, but you still have a small chance to get COVID with symptom and a little more chance to get asymptomatic COVID. If your family member are not vaccinated, you still have to be very careful. Do not get the COVID and bring home to get your family member infected with COVID. You have to wear masks and social distance until everybody you contact are vaccinated. People in my office got vaccine already. We will continue our COVID-19 infection control until everybody got vaccinated, until CDC said, as a society, we are safe to not wear masks and social distance. Eventually, this pandemic will be over. Our life will be back to normal. I can't wait for that day.